We use our teeth every day, and if you're lucky, you still have the same ones since you were 12 or so. And as the old saying goes, an apple a day keeps the dentist away. But if your teeth are becoming tired, those apples are getting hard to chew. Here are some tips to keep your teeth strong. I can't necessarily say I've ever been excited to be at the dentist's office, but today I am because we have an amazing guest. I'm hanging out with Dr. Chris Hawk. He's with Absolute Dental here in Reno and in Carson City to talk about brittle teeth. As we age, our teeth become brittle. Dr. Hawk, why is that?
Yeah, that's true. That holds true for multiple reasons. As we age, we basically only get one set of teeth for our adult life. All the baby teeth are usually gone by about age 13. So that second set has to last us from 13 up until 80, 90, 100, however late or long we're going to live. And that being said, the teeth get brittle. There's a lot of medications that we might take as we age for high blood pressure or other things. Those tend to dry out our mouth really bad.
Right.
And our saliva has a lot of protective effects, and we kind of lose that. Things dry up, things get brittle, and these teeth can crack.
So it's not necessarily because of not caring for your teeth, though it is important to come to the dentist regularly. Your medications can also hurt your teeth.
Correct, yes. So the medication-induced xerostomia is the scientific or medical term for that, the dry mouth, but it's pretty much a side effect of just about every medication that's out there. And there's a lot of ways to help kind of combat that or prevent that. Some cases they might consider switching your medication to something else if the side effect is really bad. But you can chew gum or sugar-free lozenges, things like that that don't contain sugar are really good at helping stimulate your body, produce saliva, and getting a little bit more of that protective effect, and then giving some moisture in your mouth at the same time is more comfortable than feeling like your mouth is so dry all the time.
Huge issue. And coming to see your dentist regularly, how often?
Yeah, I would say the standard is usually every 6, but that interval can usually change. It can be every 3 or every 4 months. And a lot of that is going to be based on what's usually deemed as a risk assessment. So when you come in for your initial exam, they're going to do a full comprehensive exam and pretty much look at everything in your mouth, and then from there set up a routine, interval basically to do cleanings and checkups, and it could be anywhere between 3 and 6 months.
Now, if someone at home is watching and says, I've noticed my teeth are becoming more brittle, maybe breaking when they have certain foods or something, what are some of the solutions to that?
Well, so there's a few solutions. One would be going to the dentist and getting it looked at first. The main thing is that if the tooth is restorable, then they could go ahead and restore it. If it's not, then you might be looking at something like an extraction and getting some sort of replacement in there, which I have some examples of that. But then obviously getting all your other teeth checked so they can maybe catch if there's cracks or there's fracture lines that are occurring to get those teeth restored before they shear off or break off completely.
And what are some of these here?
So what these here are some options or replacement options for missing teeth, and it kind of goes through a little schematic, starting with kind of the basic way, which would be what's called a partial denture. A partial denture would basically be a plate that would have, in this case, we're talking about just a single missing tooth, a replacement tooth on that plate that would then be taken in and out of the mouth, and you'd have to kind of clean it in between meals. That can sometimes be a little bit cumbersome. So sometimes you might opt for something a little more permanent or something a little more fixed, like a bridge or a crown. And in that case, if a single tooth is missing, you would prepare a tooth on either side of that, and then you'd have a 3-unit bridge that would go in to replace the missing tooth, and it would basically cover or protect the adjacent teeth.
I'm not getting the chills talking about this, but I am. Now, what about the graft? Where's that?
Yeah, so sometimes the best way usually is if, say, you mentioned earlier when we were just talking that you knew a friend or someone you were caring for who broke a tooth on a steak.
Yeah.
In a lot of cases, if the tooth breaks off, then it might end up needing to be extracted or removed.
Right.
So I would usually extract the tooth and then put in what's called a bone graft. That functions also as what sometimes is called ridge preservation to keep the bone height good in that area or adequate enough. And then I would go in and place an implant secondarily, and that would function as a single unit tooth.
Great, so there's a lot of options with the inevitable. Like you said, using your teeth every single day for your entire life or from 13 on. Got to take care of them well. So Dr. Hawk, thank you so much. We appreciate it.
Got it.
Fun hanging out with an oral surgeon for the day.
Likewise, thank you. Thank you so much.